Hi everyone, welcome back to my YouTube channel, and today we are going to talk about uterine polyps. So let's start the topic with introduction. Uterine polyps, also known as endometrial polyps, are growth that develops in the inner lining of the uterus, that is endometrium. They are usually benign but can sometimes be precancerous or cancerous. These polyps vary in size ranging from few millimeters to several centimeters and may be attached to uterine wall by thin stalk or broad base. They can occur singly or in multiples and may protrude into uterine cavity, or in some cases it may extend into vagina. Causes of uterine polyps. The exact cause of uterine polyps is not fully understood, but they are believed to result from hormonal factors, particularly estrogen, which stimulates the growth of endometrial lining. These factors include hormonal imbalance, especially excess estrogen, obesity, hypertension, use of tamoxifen, that is a drug that is used in breast cancer treatment, and age, that is more common in between women of 40 to 50 years of age. Symptoms of uterine polyps. Many women with uterine polyp may not experience symptoms, but common signs include irregular menstrual bleeding, heavy periods and spotting between cycles, bleeding after menopause, infertility or difficulty conceiving, vaginal bleeding after intercourse, pelvic pain or discomfort that may be less common. Diagnosis of uterine polyps. Diagnosis of uterine polyps involves several methods. First is transvaginal ultrasound that helps visualize polyps within the uterine cavity. Second is sonohysterography that uses saline infusion during ultrasound for clearer imaging. Third is hysteroscopy, that is a thin lighted instrument inserted into uterus to directly view and possibly remove polyp. Fourth is endometrial biopsy, that is tissue sampling to rule out cancerous changes. Complications of uterine polyps. If untreated, uterine polyps may lead to infertility due to interference with embryo implantation, recurrent miscarriages, risk of precancerous or cancerous transformation, although it is rare, chronic abnormal bleeding that affect the quality of life. Treatment of uterine polyps. Treatment depends on symptoms, size, and risk factors. First is watchful waiting. That is when there is small asymptomatic polyp and may resolve spontaneously. Second or treatment option is medication that include hormonal treatment like progestin and gonadotropin releasing hormone agonists that may temporarily reduce symptoms but are not long-term solution. Third treatment option is surgical removal, that is hysteroscopic polypectomy, that is the most effective method and it is often performed as an outpatient procedure. Fourth treatment option is hysterectomy, that is rarely required and it is reserved for recurrent or suspicious polyps. Prognosis of uterine polyps. Most uterine polyps are benign and can be successfully treated with hysteroscopic removal. Even though recurrence is possible, but regular follow-up may reduce the risk. Fertility outcome often improve after removal in women that experience infertility due to polyps. Prevention of uterine polyps. There is no concrete way to prevent uterine polyps, but maintaining hormonal balance, managing weight, and regular gynecological checkups can help in early detection and management. Conclusion of this lecture video. Uterine polyps are common gynecological condition that can cause abnormal bleeding and infertility. While mostly benign, they require proper diagnosis and management to prevent complications. Early detection and treatment, particularly hysteroscopic removal, provide excellent outcomes and improve reproductive health. And this is all about uterine polyps. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.